Hi there, it's Amy from Synergy Physio. Lots of my patients have pain or injuries at the moment, maybe from following Joe Wicks's PE lessons in the morning, either with your children or alone, but maybe slightly too enthusiastically. And now you're unable to get an appointment with a doctor or a physio. If this is you or someone that you know, please stay with me. We have a fully operational online injury clinic, and I've been seeing patients online for the last couple of weeks, and I just want to share a couple of things with you. I'm going to show you how I will assess and diagnose you via a video consultation. Maybe you've got a running injury, you've been out in the garden, the weather's been glorious, or you're trying to exercise at home to stay fit and healthy at the moment. Maybe you're hunched up at a desk, you're working yourself, trying to homeschool your children, stresses are high. Maybe your neck or your lower back is just getting a little bit sore and you've got pain as a result of this. But the most important thing is, we need to get you an assessment, some advice, and then create an exercise plan on how to treat this. What if I told you that we're able to do this all from our bespoke consultations, all via an online platform? Okay, so here's how it works. I had a really lovely lady earlier this week who was having pain between her shoulder blades. She was getting this intense burning sensation that was becoming unbearable. We chatted through the problems to get a good understanding of her condition, looking at her home setup and what her triggers were for this pain. I then conducted a full assessment. Here's the thing, I can see you on the video, I can assess you, I don't have to have my hands on to do a full thorough assessment. This can be done visually via the video link. I did the following test on her and I'm going to demonstrate to you now. First of all, I just wanted to have a look at her posture. So I asked her to stand in front of the camera so I could see her head to toe. Stand nice and relaxed, just to get a general observation of how she stands. I then asked her to turn to the side and asked her to put her hands across her chest so I could see exactly what was happening down her spine. I then asked her to turn away from me so I could assess her from behind. I then asked her to sit on a chair so that we could assess her neck. She sat down and I asked her to take her chin down to her chest, look up to the ceiling, look over the left, and then the right, and then either side. Throughout, I asked her if she had any pain, discomfort, and most importantly, if any of these movements were recreating her symptoms. The final assessment was of her mid-back, so I asked her to turn to the side, hands on her shoulders, and curl herself down. We then did the opposite movement where we lifted up to extend her back, and then back to the middle. For the final one, I asked her to turn away from me with her hands across her chest. So hands across the chest, and then twist around to the left, and then twist to the right. Clear as daylight, I could see what was going on. I could see by just getting her standing and looking at her general posture of her shoulders, of her chin, what was going on. She had postural back pain, upper back pain, and with her shoulders slightly forwards, as everything we do when we're typing, sitting, we generally have protracted shoulders. The muscles that attach her shoulder blades to her spine, called the rhomboids, were getting really sore. And this can cause a really intense pain. So what do? We went through some exercises together. So on the video, I demonstrated and she followed me. And I'm going to show those to you now. The first exercise was lying on her back. Arm out to the side, knee bent, and pulling it over to the other side, trying to keep this arm flat on the floor and getting the knee as close to the floor as possible. And then we swapped sides. We held this stretch for 30 seconds and then repeated it 3 times. The second exercise, on hands and knees, pushing the shoulder blades apart, and then sinking back down and squeezing the shoulder blades together. Pushing them apart and then squeezing them together. She repeated that exercise 10 times, had a rest, and then did it 3 times. For the final exercise, my lady had a yoga mat at home. If you don't have a yoga mat, that's absolutely fine. You could use a towel rolled up nice and tightly, just so there's something firm under your back. This was placed on the floor, and then again, we're going to lie down. You want the block to be just in the middle of your back. Then lying over the back, lifting your arms above your head. And then back down. And you're going to do that 5 times before moving the block slightly higher up and repeating. So it really is straightforward to get quick and easy advice through one of our video consultations, all from the comfort of your own home. You don't have to have any equipment. We really can be creative and think outside of the box for you. Doing those simple exercises alleviated my patient's pain almost immediately, and she could see the benefit and therefore was engaged to carry on those exercises. If you want more information or to book an assessment, please click on the link below, or you can send me a private message via email and we can discuss further whether this is right for you. Thanks for listening. I hope you're staying safe, staying at home and taking care of yourselves and your family. Thanks again for listening. Goodbye.